Hello everyone, my name is Christopher Black and welcome to a very special World Health Day event. Today is April 7th and around the world people are marking this important day, a day like no other World Health Day that we've had in the past. It's a day that we're celebrating health workers, specifically nurses and midwives around the world who are working so hard through these tough days of coronavirus around the world. I'm glad to be joined today by some very special guests that I'm so proud to introduce. We've got WHO's Chief Elizabeth Ero, we've got the WHO Director General, Dr. Tedros, and we've got colleagues who are nurses and midwives around the world. First, I'm going to go over to Elizabeth Ero, and she's going to tell us a little bit more about these special guests we have. Thank you so much for joining. This is going to be a great show. Elizabeth Ero, tell us more about what we're going to be doing. Elizabeth, you have to unmute your mic, please. Perfect. Elizabeth.
Thank you very much, Chris, and thank you very much for that nice introduction to this event today. Good morning, good afternoon, and good evening, everyone. And of course, happy World Health Day, a day dedicated especially for nurses and midwives as part of our International Year of the Nurse and the Midwife. I am very pleased to be joined today, especially by our Director General, Dr. Tedros, as well as some of the special guests who I will introduce to you and who will be talking to us later on. We have Neha Mankani from Pakistan. She's a public health practitioner and a midwife. She currently works at the Global Health Directorate of Indus Health Network in Karachi, where she is setting up and managing midwifery and maternal health programs at primary health care sites. She is managing a team of midwives directly dealing with the coronavirus pandemic. Our second guest is Dr. Sari Dashi from Iran. She's a senior Iranian midwife and we have been working on the crisis since the outbreak started. Our third special guest is Floriana Pinto from Italy, a registered nurse in Milan at the center of the COVID pandemic. She has some really compelling stories and is able to speak to the life in the COVID intensive care units in Milan. Finally, we have Joe Nikonjira from Malawi, a senior nursing officer from Balopi District Hospital, Malawi. He is a member of the district rapid response team, which is working on preparedness to respond to the pandemic. The team is coordinating all matters regarding to the epidemic, among other things, conducting awareness to the health workers and plans to scale up to the general public. These are our very special guests today, Chris, and really looking forward to hearing their story. Thank you very much. I'll hand over back to you.
Thank you so much, Elizabeth. Without further ado, we're going to go talk to our Director General, Dr. Tedros. Director General, I know this is a special day for you. You talked about it yesterday in our press conference. We're so glad you could join us today. Perhaps you could give us a few more words on what this day means to you and your message for health workers around the world, sir.
Thank you, Chris. Good morning, good afternoon, and good evening, wherever you are. Today is WHO's birthday. It was on 7th April 1948 that WHO came into being. It's a day we mark every year as World Health Day. Today and throughout 2020, we're highlighting the vital role of nurses and midwives as part of the International Year of the Nurse and the Midwife. It may not seem that there are many reasons for celebration. As we all know, the world is in the grip of the most severe health crisis of our time. The COVID-19 pandemic is reminding us of the vital role nurses and midwives play. Every day, nurses are putting themselves at risk to alleviate suffering and save lives. They are reorganizing wards to open more beds for COVID-19 patients while continuing to provide care for other patients with urgent health needs, including women in labor. They're taking stock of equipment and lending it across units. They're learning on the job with information that changes daily, even hourly. And nurses are doing the unthinkable because critical COVID patients are isolated. The last human touch they may feel is that of a nurse's hand. The kindness of caring strangers has never been more important. I hear stories about nurses video calling family members late in the night so they can say goodbye to a dying relative. Because health workers are on the front lines of the fight against COVID-19, they are also among the most at risk. More than 3,000 health workers have been infected, and many have paid the ultimate price. When health workers are exposed or become sick, they have to go home and stay there for at least 2 weeks. Hospitals scramble to find replacements. That's why we must ensure that health workers have the medical masks and other personal protective equipment they need. Meanwhile, babies are still being born. Midwives are still trying to provide care to make pregnancy and childbirth the safe and joyful experience it should be. Midwives are doing their best to stay in touch with their clients by phone and screen. But not all women have phones. They worry for those they can't reach. Today is the day to celebrate nurses and midwives, to thank them for everything they do, and to commit ourselves to doing everything we can to support and protect them. One of the lessons I hope the world learns from COVID-19 is that we must invest in nurses and midwives. Today, I'm proud to launch a new report by WHO, Nursing Now, and the International Council of Nurses on the state of the world's nursing. The report shows that 80% of the world's nurses work in countries making up just half of the world's population. Although the number of nurses globally increased by 4.7 million between 2013 and 2018, the world is facing a global shortfall of 5.9 million nurses, especially in Africa, Southeast Asia, the Eastern Mediterranean, and some parts of Latin America. We're calling on countries with shortages of nurses to increase the number of nurses they graduate by an average of 8% each year, and to implement measures to improve the employment and retention of nurses in the health system. We're committed to working with all countries to ensure that nurses and midwives receive the training they need, the recognition they deserve, and decent conditions and salaries for their work. To every nurse and midwife, I say thank you. Thank you so much from the bottom of my heart. You have our deep admiration, respect, and gratitude. And as I said earlier, this is the report of the state of nursing which we're launching today, and you will have all the information you need. This is the first, and we will continue every year reporting on the state of nursing. Thank you so much again.
Thank you so much, Dr. Tedros, for those words and for highlighting that report, which I believe is now on the website, and for mentioning our partners, International Council of Nurses, Nursing Now. I know they're watching this show with us, and we're really glad for their support on this report. Elizabeth, I'm going to hand it back over to you now. We're going to go through some question and answers for our colleagues who have joined us from around the world. It's really fascinating, but also I'm going to put you on the spot, Elizabeth, a little bit. You mentioned where everyone else is from, but I don't think you mentioned where you were from yourself. So you're a long way from the Pacific here. If you could tell us a little bit about what brought you to Geneva today.
Thank you very much, Chris. Of course, I am originally from the Cook Islands, from within the Pacific Islands, and really far away, I suppose, from the happenings around the COVID-19. But still, my country is preparing very advance of the likelihood of one case getting onto the islands. And they are doing some very innovative and interesting preparation work. So I will probably post some of those out for us later on in the day. But that's where I am from, Chris. So really pleased to be a part of this global group, global panelists today. Thank you.
Indeed, we have people from around the world. It's really representative. So I think first we're going to go to Neha, who, as you mentioned before, is a health practitioner and midwife in Pakistan. Neha, if you could tell us a little bit about your work in regards to the COVID-19 pandemic. Neha, if you could unmute your connection now. Thank you so much for joining us. We're really happy to have you with us today.
Thank you. Good afternoon, everyone. Thank you for having me here. As Elizabeth mentioned, I work in Pakistan. I'm based in Karachi, and my work is two-pronged. I work with the Indus Health Network, which is working very closely with the provincial government in COVID response. So we have a treatment facility, which is hospital-based, but we are also taking an integrated approach to the response. So we're working on testing and identification. We're doing contact tracing through our outreach programs, but also providing social support, treatment, mental health services. I work with a large midwifery-based program. So a large part of what I'm focusing on is helping midwives understand their new normal and bringing them all the information they need and from whatever we have to be able to continue to serve women and their families, their communities, and help them remain focused on quality care and respectful services at this time. So all the response has to be really quick. So we're trying to get all the standards and information we can and get it translated into local languages and get it out there so they can continue working. The other work that I'm engaged in is I manage a nonprofit. It's called Mama Baby Fund, which provides financial assistance to women and families in the maternity care process. So as we see the infrastructure around us crumble with the weight of this pandemic, we are helping families that are struggling financially in this process.
Go ahead, Neha.
So we're helping families that are struggling financially at this time by providing them funds for hospitalization, and at the same time also working with midwives to get midwives all over the country to get them information and help them continue their work. So Pakistan does have a very fragile health system. So as you can anticipate, we are struggling right now, but we're really seeing mid-level healthcare providers like midwives and community health workers come through and become frontline workers at this time.
Thank you so much. I believe Elizabeth has a question for you.
I suppose the question I was probably going to pose, Chris, is what are some of your challenges that you faced by you and your fellow health workers?
Elizabeth, I think I speak for many healthcare workers around the country and around the world when I say that one of the largest issues we're facing right now is fear. Midwives, public health providers, community health workers, nurses, everyone is struggling with the idea that there's so many uncertainties in this situation, and yet ethically, professionally, financially, everyone has to go to work. Everyone will show up the next day, but every day that we are at work, we come home thinking that is this the day that I'll get sick? If I were to get sick, what would happen to me? What would happen to my family? Would I be able to get the healthcare I need? Would I still get paid? There's a lot of job insecurity around midwives in the country. The cases we're hearing about midwives getting sick and losing their jobs, a lot of times funding is getting shifted towards COVID response. So some facilities are taking away funding for maternal health programs. I personally think midwives are finding it very hard to do their jobs right now because of the community fear around coronavirus. So an example I'll give you is through the Indus Health Network. I manage a midwife-run labor room in a rural facility in Pakistan. And over the past year, my team and I have worked so hard to bring safe deliveries and antenatal care to a community that was very dependent on traditional birth attendants. And now in the past month, we've seen a 75% fall in our delivery rate. People are returning to traditional birth attendants for deliveries because they don't want to they don't feel safe leaving their homes to seek healthcare anymore. And midwives who do not have mobility can't always make it to them. A lot of midwives I met are also say that they're not considered frontline health workers. So when it comes to distribution of PPE and masks and protective equipment, they're often the last ones to get anything. So while our focus is so much on respectful maternity care, our midwives are turning around and asking us how we expect them to use touch and how we expect them to be there for women when they don't have protective equipment in labor rooms. Another example is I visited a hospital recently where a midwife who I know, I've worked with her before, I've met her before, she's a very compassionate woman. She said, look, I really love my work, but at this point, because I don't have what I need to do the work, if I see a COVID positive woman who's in my maternity hospital, I'll tell her that she needs to leave and she needs to go somewhere. I can't serve her. So these are some of the issues that I think are very specific to midwives. That we really want to do what we've just been doing, but it's just becoming harder and harder because of the pandemic.
Thank you, Neha. So what thinking about those challenges, what kind of support do you need? Not only during these outbreaks, but also just more generally, what support do the midwives need in Pakistan?
I think when we talk about midwives and general support, I mean, overall, I think we just need to strengthen our health systems so that they can be more responsive to these kinds of colossal health emergencies. Because while we respond to COVID, we also need to be able to continue to provide other essential healthcare services, and maternity care is one of them. But I also hope that as midwives and other community health workers become frontline health workers, and as we return to our new normal, we can get them the recognition they need of their impact on health equity and quality healthcare. You know, we have better standards of training, we have more information and the equipment that we need. We can start acknowledging them as essential health workforce. But right now, at this moment, I think what they just need is support. They need what everyone else right now needs, which is more information. And they need to know that, people are behind them as they continue to work.
Thank you so much, Neha, for those words. Stay on the line. We hope to come back to you later on in this show. Next, we're going to go not too far away from me here in Switzerland, just down the road, about 3 hours by train to Milan. We have Floriana. Floriana, thank you so much for joining us. Grazie for your participation today, and also for all the hard work. As we all know, the situation in Italy is worrying. You guys, your health workers in Italy have been working around the clock, saving lives. If you could tell us a little bit about your work these days in that area. Floriana.
Okay. First of all, thank you for giving me a possibility to talk with you today and to share my and my colleagues' experience. About my work, I've been working in ICU in a large Milan hospital since 4 years, and we have usually 12 people, and each nurse cares for 2 of them. For the emergency, we have to widen our intensive care unit into floors, having 40 beds, and each nurse has to care about 5 people. So nursing were crucial in this emergency in all its essence, because they have to care for people not only in hospital but in long-term care homes, nursing homes, and so they are totally involved in this emergency with all their competencies, so the organizational, the relational, and the clinical ones. And in general, in our region, in Lombardy, but in all Italy for the emergency, lots of hospitals have been reorganized in no COVID hospital and COVID hospital, but lots of them have COVID wards and no COVID wards inside it to granting care for everybody, infected and uninfected patient. So when we had to go to the front line of this emergency at the end of February, there was no time for us to think about it. We have to respond to this emergency and we had to do it. And we were worried about how could it be possible for us to put our best competencies to save these people from this invisible enemy who nobody didn't know and nobody doesn't know really until today. So the first days were confusing for us, but everybody put their best competencies to try to do their best. And for us, for nurses, work change in terms of new structures. For example, in my hospital, we had to create new intensive care units in surgical units, in operating theaters, together with colleagues coming from other wards. It changed in terms of protecting clothing, who are really heavy to wear and barely allow us to breathe normally. It changed related to the staffing level, as I said before, and it changed also related to the rational use of time, try to delivering the best care. So our lives now are like being on roller coaster lives, because some days we feel fatigue, we feel anger, but suddenly comes the joy when we finally manage to transfer our patient from ICU to the wards, or from the wards to their own home. And when we find time to communicate with them, even if the time is too short, and even if these clothes can barely allow us to breathe. And this is one of the most beautiful things of this period, because we have learned to communicate with them, to smile with them with our eyes, because you know, with our mask, it's impossible. Sometimes it's difficult to communicate and to smile, so they can see us. And so I can say it's easy, it's really difficult, but I think that everybody is put their best to do the best they can for this emergency, in clinical skills, in relational skills, just to help sometimes. And this is the most beautiful things I'm seeing during this period. And if I think it is what I've always want to see in nursing, because this is the proof that when they want nurses are a really powerful team.
Marina, just that's really, really amazing what you guys are doing out there at the front line. You talk about, rational use of time, which I think is really amazing. You're there for a long time. How do you, where do you get the inspiration and the motivation to continue doing what you do in some not so, some difficult situations?
Yes. So we have lots of challenges during this period, but the motivation, Elizabeth, I think that this pandemic is showing to nurses themselves what kind of professional are they. In Italy, lots of nurses have lost their professional identity because institutions don't support us so much. But I think that this experience is teaching us a lot, and is teaching us how much power we have to improve health, and how much power could we have to improve policy. But I can say the reality is so kind as I'm telling you, because it's quite bad, and it slams you in the face in terms of physical and psychological stress, lack of protection, inappropriate staffing levels in hospital, and not only in hospital. The system now is not really protecting us, because when we go out from the hospital, from our work in a COVID area, we have to fight to find COVID swabs, which is not guaranteed we'll find it. We have to fight for proper PPE. We have to fight for proper staffing level and proper skill mix. And these problems are the same, not only in hospital, but also outside, because nurses are not enough to care about people in their own home, not only the infected ones, but the other with the chronic disease, who are showing now complication of this disease. And so all critical points of the system now are coming out in the territory. And in Italy, we have a totally absence of a nursing primary system in the territory. For example, the system could have engaged nurses in educating people at home about isolation rule. Nurses in hospital are also now teaching and supporting younger nurses recently graduated who have been engaged in hospital with precarious contract for the emergency. And it's a really difficult situation because we are feeling responsible for them, but how is it possible for us to help them if our staffing level has doubled now? And in Italy, the staffing level of patients and nurses were high before the situation, because a nurse has to care for from 7 to 14 patients. So, you know, if you compare to the international recommendation, it is a really bad situation. Also, another challenge is the psychological assistance. We need nurses and health workers now need psychological assistance, because in this in this framework, both patients and health workers have an emotional impact related to the coronavirus. Because you know, we are worried about ourselves, but most about our families that we can potentially infect when we come back home. And in Italy, we raised more than 12,000 infection among healthcare workers. Among them, more than 100 have died. 23 were nurses plus 2 suicides, and this is shocking for us. And among us, lots of people are showing psychological problem like anxiety, stress, like sleeping disorders and burnout. So this should be considered from the institution, from the stakeholders. In first aids and ICU, moral distress is showed because about the max emergency protocol, because everybody was worried about the fact that treatments wouldn't be enough for everybody. And this situation was the same in the territory, because lots of nurses were worried for the people with chronic disease who couldn't have nursing care in their own home. But what would I say is that before the pandemic, Italian nurses were already exhausted by the working condition. Our salary were blocked from 20 years and are the lowest in the Europe. But nurses, in our Italian nurses, have always stayed here to improve people's health. And our attitude is to think and take care of people. And we are doing it the best as we can until now.
Thank you so much, Floriana, for sharing your story. It's really some inspiring words from you and your colleagues, and our thanks go out to them and all the nurses and midwives around the world who are responding to this crisis. We're going to go next to our friend Joe, who's joined us all the way from Malawi today. Joe, one thing other people have been talking about that's really so important, either they're involved in response to the coronavirus COVID-19, or they're preparing to be responding to the coronavirus. I know your work is more on the preparation side. Perhaps you could walk us through a little bit what you've been doing in Malawi on this angle, and tell us a little bit about your work. And thank you so much for joining, Joe.
All right, thanks everyone, and thanks to DG for arranging this conference, and also for expressing concern in regards to COVID-19. We really appreciate the work that WHO is doing in giving the information to the affected countries, and also communicating in terms of the information regarding prevention and case management. Regarding my work, basically, I'm more into rapid response team, which is a team that is working hand in hand with the rest of the health workers as multidisciplinary team, make sure that we are coordinating efforts to prevent the spread of coronavirus. So among other activities, we are conducting awareness meetings about COVID-19, with health workers, patients, as well as community. We are also advocating for efficient use of the already a few resources that we have, resources like gloves, masks, as well as the hand washing facilities, so that we're able to use them efficiently. Also, we are working on the infection control measures because normally we have problems with people adhering to infection control. So with the coming in of COVID-19, we've focused on also making sure that people are adhering to the practices. We formulated some local policies for the ward that people should be able to use and provide guidance. And we're also able to monitor that people are implementing the standards through the charges of the specific wards. We have also instituted a traffic control because normally our facility is congested. So we've worked on local policies of decongesting the facility by, among other things, increasing the consultation rooms and also implementing the circular that the Ministry of Health has so far given us to suspend all the non-essential services so that we have at least few patients coming to the facility. Also, we are focusing on the triaging and isolation of the patients who are presenting with the symptoms suggestive of COVID-19. And for those that need further investigations, we are isolating them and then doing the investigations to rule out if perhaps they have similar conditions to other infections that resemble COVID-19. Also, we've intensified surveillance and the rapid response by doing case follow-up for all the suspected cases in the community. So when we have a report that maybe a certain client is reporting some symptoms in a certain community, the team goes there to make sure that we've ruled out the case, or maybe we institute monitoring mechanisms so that maybe in the next 14 days we're able to conclude that the case is not it's just not a suspect anymore. We're also working on psychosocial support for fellow nurses and midwives and the rest of the health workers because there is an increased fear among our health workers due to issues of inadequate PPEs. So nurses are afraid that they may contract the virus. So we are trying to make sure that the resources are available and giving out the information on how they can prevent the COVID-19 so that at least we're able to address the issues of stress. So apparently that's what we are doing.
No, it's really amazing because we know you have when you have a good plan and well prepared, it goes a long way to mitigating the anticipated crisis. Can I just ask, what is your most, what do you think is the most challenging issue for you and your co-workers in light of COVID-19?
All right, so in Malawi, generally, we already have shortage of nurses as well as health workers. Malawi only has about 0.5 professional health workers per 100,000 population. And the WHO calculated that the country needs at least 4.5 professional health workers per 1,000 population to realize universal health coverage as well as SDG. This is according to WEMO's report of 2017. And also the staff ratio, the vacancy rate rather, is at 51% as reported by workload indicators of staffing needs by World Bank. So already we have the shortage of staff. And then now as we're instituting measures to make sure that we're decongesting our facilities, we're like overstretching the already few number of staffs because we have increased like consultation rooms, and we have also increased activities like isolation and the like. So this is indeed impacting a lot on our already stretched staff. However, the government has committed to recruit about 2,000 more nurses and the other health workers as in response to the COVID-19. So we are just anticipating that the nurses that can be recruited can perhaps improve the staffing levels. The other problem that we're facing is inadequate PPEs and essential equipment like masks, gloves, protective suits, oxygen machines, as well as ventilators, just to mention a few. So we really need this kind of support because we cannot fight COVID-19 without being protected. Otherwise, our nurses will die from preventable measures that we can institute. So as a district, we are trying to organize by listing all the equipment that we need. And we have so far submitted the list to the settlement stores, which is a central pharmacy, for us to be considered when they're doing the procurement. And also, we have challenges with the quarantine facilities for both staff and patients because we do not have the infrastructure that we can say this is our quarantine place. So maybe we're anticipating to have some tents that can be constructed, that can be used as isolation camps. We also have problems with our communities because some are still not aware of the dangers of the COVID-19. They're still doing business as usual in terms of the local gatherings and the like, despite the ban by the government. So people are still not taking it seriously, and we need to really reinforce the messages of prevention measures so that people are really understanding the dangers of this virus. Thank you.
Thank you, Joe. It's definitely not business as usual these days. So those are wise words, my friend. And thank you so much to you and your brothers and sisters and all our colleagues in Malawi for the hard work that they're doing. We're going to try to come back to you, but for the moment, we're going to Dr. Sarah, who is a midwife, a senior Iranian midwife. Sarah, thank you. Salam Chitori, and welcome to our show. We look forward to hearing your thoughts. Like Italy, Iran, we know, has lots of work in this area. It's been heavily impacted by COVID-19. How has it affected your work, and what have you been doing in terms of the response in your country? You may have to unmute your mic, please. There we go.
No, you can hear me?
I can hear you now, like you're in the room with me. Thank you so much for joining us.
Okay, thank you. Thank you very much. And then I'm Dr. Sarah Dashti, University tutor, and also member of Director of Iranian Scientific Association of Midwifery in Iran. I contribute to translate and writing guidelines for prenatal postnatal care during the COVID-19 pandemic based on the latest finding and considering the current condition. The role of midwife in COVID-19, I just divided in some points. First, increase the knowledge of midwife regarding the COVID-19, include the sign and symptom diagnostic tests, screening, triage, referral management of pregnancy and labor in women with COVID-19 infection throughout the distance learning and teleconsultation, to reducing the pace of the disease dissemination in society by increasing the awareness of the pregnant mother and families as a healthcare workers regarding the route of the transmission of the coronavirus. Third is reducing the stress of pregnant mother in this critical time, screening mothers and identify the high-risk mothers for referral to the higher level of the primary healthcare system, reducing the frequency of the prenatal care visit due to the social distances. 6 is using of the telemedicine and teleconsultation technology to follow up mothers and providing emotional and scientific support to mothers. And one of the value action of Iranian Scientific Association of Midwifery was a supply PPE for medical and healthcare personnel in line with other midwifery association throughout the ICM, and the UNFPA Iran country office also has put great effort in providing the PPE. And then this has a result in better integration and cooperation of the various association and Iranian Medical Council. We also participate in the development of the protocol for prenatal, postnatal care and vaginal delivery in COVID-19 infected women based on the latest published research and WHO guideline. Although COVID-19 pandemic has a reduced practice performance of many jobs, the workload of the midwife has increased in this time. Due to the shortage of the medical personnel, some midwives are now forced to the work as a nurse. Unfortunately, we have midwives who lost their lives in providing their healthcare and the medical service. The work of midwife has led an acceptable low rate of maternal deaths due to the COVID infection.
Thank you so much. So Elizabeth, do you have a question?
Yes, I do, Chris. I just kind of wanted to ask Sarah, like, in all these challenges you mentioned, what is the support that you need, not only during this outbreak, but for afterwards as well, or generally?
I want to divide the challenges in the three parts. That the practice-related challenges include the conducting that the raise due to the changes in the setting health and medical care, including the reduction perinatal visit has resulted in online and telephone follow-ups, which has a limited uses in the past. And one of the challenges in this time is that the mothers may neglect some important issue that seems not important to them. And the midwife misses due to the shortage of the physical and visual contact with the pregnant mother, as well as the shortage of access to the laboratory and imaging equipment, including the ultrasound devices. On the other hand, this condition is the opportunity to improve or telemedicine infrastructure to improve the consultation. And also due to the emergence of the disease, the Ministry of Health Iran banned midwife practice in the private clinic, but permitted practice for obstetrician and gynecologists. This has a result of fraction in the midwife and increased workload of the specialists. On other hand, due to the poor economic condition of some families due to the social distancing, limited access to midwife may also put together economic burden of the poorer individual that are now obligated to pay higher for the regular visit by the specialist. And also due to the reduced number of the visit, private medical sector now face to the economic issue, as most of the teleconsultation are provided for free. And the midwife now facing the shortage of the PPE in delivery room and healthcare centers. The client also problem that we have with our client is increase the stress in women and pregnant mother due to the reduction in the number of the visit and limitation of access to the midwife. And due to the reduced capacity of hospitals in combating the COVID-19, many hospital and midwifery centers are now assigned COVID-19 clinics. Therefore, the pregnant mother are forced to refer the private hospital for the delivery and laboratory and imaging procedure, which costs to them and much more money for them. And then the healthcare system should now acknowledge the capacity of the midwives and provide the legalization for facilitate the supervision of the physiologic delivery at home by midwife. That this is a ban in Iran. And then if for the last part is education related challenges due to the closing the university, distance education and evaluation are needed to continue student education. Unfortunately, the infrastructure to perform distance education in the most university of Iran is weak and require the immediate improvement.
Thank you so much. So for the people who are joining us, we're getting near the end of a very special edition of one of our live shows. This is World Health Day 2020, April 7th. Around the world, people today are celebrating health workers and their hard work in the response to the coronavirus. And more importantly, we're looking at the critical work of nurses and midwives around the world. I've been so honored to be joined by people from all 4 or 5 different points around the world here live, and also people have been joining, and we've been receiving many, many comments, and we really appreciate that so much. We're going to go for a quick message, if we can. Every person who's on the call here, if you can give us our message for World Health Day, the one thing you want people to remember. Sarah from Iran, doctor, what would you say? What would your message to the world be today?
I think the best important things that I want to say, the more than 13,000 licensed midwives are now working in the private clinic, midwifery center and primary healthcare centers, and more than 12,000 midwives are providing primary healthcare centers. These statistics show that the enormous capacity of midwives to perform many tasks that are included in their teaching curriculum, but not applicable due to the medical legalization, include the physiologic delivery. We ask the Iranian Health Ministry to acknowledge more important roles for midwife in the health and medical care in the field of study. We also suggest that using the term of family midwife, like family physician, to provide care, consultation, not only for pregnant mother and but also for other family members to improve the family health. And then the last things that I want to say, that improve the e-health literacy for all people, even in health worker and also population. The e-health literacy now is an important role, and especially in COVID-19. Another things that I think is important is a complicated grief, that another 6 months maybe we face with this issue, that all nurses and midwives can help to release these problems. Thank you very much.
Thank you, Doctor. Merci from us. Thank you so much for your participation today and your thoughts. It's really inspiring. Next, we're going to go to Floriana from Milan. What is your message for the world today on this World Health Day?
If you allow me, I have 2 messages, one for people, for the citizen, and one for the institution. So what I would like to say to the world, that from a month in Italy, but it is happening all over the world, people is calling us heroes. But despite our continuous struggle from the past, until a month ago, we were not appropriately recognized. So what we think sometimes is, did we really need a virus to make institutions and people understand that we are the backbone of our healthcare system? So it is a sad situation if we think about it, but I hope, and I think this is our occasion, because now we have to think and care about people for saving their lives. But at the end of this emergency, we have to continue to fight for what we deserve, for supporting, for investment, and for protection. I want to say that we are the same professional as a month ago. So we are doing the same things as a month ago, with the same competence and the same dedication. Maybe in a more difficult condition, but it's not a fact of sacrifice, only this. To the institution, I would like to say that Italian nurses are asking and will ask and need not only now in the pandemic, but always, more nurses, adequate PPE, better salaries and working conditions in terms of staffing levels, advanced specialties and competencies, and training in all countries with Europe standards, investment in research, investment in training and leadership role at every level. We would like that institution organize a nursing primary care system, because its absence has a strong impact now on the chronic disease. I think that it is a matter of leadership, because if we are well equipped, the more they will keep, we will keep leadership role, the more we will be able to change and improve better people health and change the misconception around our profession. So it is an important occasion. And in this, I would say thank you to the association that are helping us in this way to, and can also help us in this way with advocating our profession and the scientific updating. I would like to say thank you to ACN that allow us to share our experience with the webinar. I would like to say thank you to CNAI, our General Association, who a few years ago say no nurses, no future. And we know that without nurses, there is no health. I would like also thank you the scientific association who allow us to have the scientific updating, like the specialistic one, like ANIARTI for critical nurses, and IFEC for the nurses of the territory. So at the end, what I would like to say is that history has taught us that nurses are able to do the greatest things in the worst condition. And I hope that at the end of this period, there will be a turning point for a destiny of a profession who now is not appropriately recognized. Now we are like in a wave. So it could be a big opportunity for us if we try to ride it. And maybe these heroes, these nurses, want only to be treated and considered as professional they are, like the other. And I think that in this frame of work, in this panorama, it could be a real possibility to build a real healthcare system where professionals can work together in multidisciplinary team, respecting each professional and gaining the same goal, which is the people health. So what I would like to say to all my colleagues from all over the world that this is the right moment and we have to start this change. And I would say thank you for giving the possibility to stay here with you today.
No, thanks to you. Thank you so much for your hard work. Thank you so much for your strong words. And thank you so much for your participation today. We really do appreciate it. Next, we're going to go to Malawi, to our brother Joe. Joe, what is your message for us on World Health Day from Malawi?
Thank you. I think this is the time that the world and the rest of the stakeholders need to appreciate the work of the nurses and the health workers. Yeah. And this can better be appreciated by investments, by investing in the nurses, in the midwives, and also in the health systems, so that they are robust enough to be able to contain pandemics like the one that we have at hand. In this way, we'll be able to save many lives. And also, most importantly, we need to keep the health workers motivated by ensuring that they have better working environment and also motivation through incentives, better salaries, as well as progression in career. It's very important for our nurses and midwives. All in all, most importantly, the capacity building for the health workers and the most importantly, nurses. Thank you.
Thank you, Joe. And I'm so glad you could join us today, that technology is held for us and we've been able to have you participate today. So thank you, sir. We'll go next to Neha. Neha, if you could tell us from Pakistan your thoughts and your message for the world on this such an important day, World Health Day 2020.
Thank you. So I think what's really interesting to me is that I've never seen the world come together. Sorry, I've never seen the world come together like this on anything before. And I think all health workers, we celebrate you. We are all together in this. And I hope, as I mentioned earlier, that when we can get through this, we can continue to work together. We can continue to be on the same page, and we can, as Flo mentioned, we can work in multidisciplinary teams effectively. And I would like to thank everyone who's trying to help us get all the information we need on our new normal, including the International Confederation of Midwives, WHO, Royal College of Midwives, that we can start making sense of the situation. And when we get through this, which we will, we can come out and realize how much stronger we are. Thank you.
Thanks to you. And we're going to go to Elizabeth now our chief nurse at WHO here in Geneva, Elizabeth. I'm wondering if you could give us some words to close down this special live event that we've had.
For Chris, no, for sure. I think it's been fantastic. Final messages from our colleagues online. I think they reflect well in terms of the timeliness, I think, of the release of our State of the World Nursing Report, which speaks to some of the issues you raised around job security, decent work places, having the right equipments to do your job, and also to the multidisciplinary team and the key role that you play within that team. I think it talks to building capacity. And so I think, I really thank you for your relentless dedication and commitment to the work you do. And I think the work of nurses and midwives, as you mentioned, is to protect our health. And at this time of crisis, we must make sure we are protecting them as well. And we cannot forget about them when the crisis is over. So as you rightly put, everyone, let us push for all countries to commit to a decade of action that begins with the investing in nurses and midwives, education, jobs, and leadership. Such investments will also drive progress across decent work, gender equity, and women's economic empowerment, and most of all, to global health security. So I thank you for this excellent sharing of your stories. And I know the world is in a healthier place, in a fairer place, because of nurses and midwives and your contributions to health. Thank you very much. Thank you, Chris.
Thank you, Elizabeth. And thank you to everyone who's joined us online today. If you want to get more information on World Health Day activities around the world or in your country, or if you want to read the report that Elizabeth mentioned, the State of the World's Nursing, those are available on WHO's website, www.who.int. You can learn much more there. And share, put a comment, give us a like, share this video today. There's other materials on the web that you can share. It's important that we mark this World Health Day, celebrate the health workers around the world, and take a moment to thank them and think about what they need in these hard times. So thank you so much for your support. Thank you, everyone. Floriana, Joe, Sarah, Neha, everyone who joined us from around the world, and Dr. Tedros, who joined us at the beginning. We appreciate his support very much. Will be more activities online throughout the day. And until next time, I'm going to try to wrap this up if I'm working on two computers at once. So I'm going to see if I can do that. And we look forward to joining you at another event here soon. So thank you again, everyone, from the bottom of our hearts here in Geneva. Thank you for your hard work, and we'll see you soon. Over and out from WHO in Geneva.
Thank you.
Thank you.